How is cystic fibrosis imaging standardized globally? Imaging plays a crucial role in managing cystic fibrosis, especially for monitoring lung health. The lungs are often affected in cystic fibrosis, leading to significant morbidity and mortality. However, standardizing imaging practices across the globe is still a work in progress. Efforts are being made to create international guidelines that help healthcare providers decide when and how to use different imaging techniques effectively. One of the main goals is to establish clear, evidence-based guidelines that can be applied worldwide. These guidelines will help healthcare professionals choose the right imaging methods based on factors like a patient's age, lung function, and treatment plan. This approach aims to create consistency in how cystic fibrosis is monitored, regardless of where a patient is treated. Several imaging modalities are commonly used in cystic fibrosis care. Chest radiography, or X-ray, is widely available and often used, but it has limitations. It may not detect early changes in lung health. Therefore, many centers now relying on high-resolution computed tomography, or HRCT, which is considered the gold standard for assessing lung disease in cystic fibrosis. HRCT provides detailed images that help doctors monitor structural changes in the lungs. Magnetic resonance imaging, or MRI, is gaining popularity because it does not use ionizing radiation. Recent advancements allow MRI to assess lung function, but challenges remain, such as lower image resolution and the need for standardized scoring systems. Emerging techniques like hyperpolarized gas MRI and X-ray, phase contrast imaging show promise but are not yet widely used or standardized. Radiation safety is a significant concern since cystic fibrosis patients often requiring multiple imaging sessions throughout their lives. To address this, low-dose chest computed tomography protocols have been developed. These protocols aim to minimize radiation exposure while still providing high-quality diagnostic images, following the principle of keeping exposure as low as reasonably achievable. To develop these imaging guidelines, expert committees, including radiologists and pulmonologists from major cystic fibrosis centers, have reviewed existing literature and held consensus conferences. Their recommendations focus on the appropriate use and timing of imaging techniques, emphasizing the need for personalized approaches based on each patient's unique situation. Looking ahead, there is a strong push for harmonizing imaging protocols across different centers and countries. This would enable consistent assessments of lung health in cystic fibrosis patients. Additionally, integrating artificial intelligence into imaging could enhance the speed and accuracy of image analysis, improving disease monitoring and clinical decision-making. For effective monitoring of cystic fibrosis lung disease, it is essential to combine regular respiratory function tests with imaging. While spirometry is a standard test, it may not always detect early structural changes, making imaging a vital part of comprehensive care. The frequency and type of imaging should be tailored to each patient, balancing the benefits of diagnosis with the risks associated with radiation exposure. In summary, while there is no single standardized imaging protocol for cystic fibrosis at this time, international efforts are underway to create guidelines that recommend a tailored approach using various imaging techniques. These efforts emphasize minimizing radiation exposure and harmonizing practices to ensure high-quality monitoring of lung health in cystic fibrosis patients worldwide. Always consult healthcare professionals for personalized medical advice regarding imaging and treatment options.